The rapidly spreading virus is linked to several birth defects in Latin America, particularly in Brazil, with concerns now that it could explode around the globe.
This is not a life-threatening infection like HIV or like Ebola. But the problem is that the complications of this relatively mild illness do have potentially devastating effects for families. To have a child with microcephaly and to have a tenfold increase in numbers and the potential for spread, not just across Latin America, but into Africa, into Asia, which have the highest birth rates in the world, we believe is a matter of public health concern and constitutes an international emergency.
The agency is seen to be more proactive in its response to this outbreak after systemic failures were identified in its initial response to the Ebola outbreak, which devastated parts of West Africa. The U.S. Centers for Disease Control and Prevention confirmed the first Zika case in Texas earlier, with officials saying the infection arose after sexual contact with someone who had traveled to Venezuela. In addition to the Texas case, the virus is now thought to affect more than 20 countries in Latin America and the Caribbean.
With Zika, we don't know exactly how long someone can remain infectious, but in this case, as we understand it, someone had just gotten sick with Zika, and that individual's sexual partner then developed Zika without a travel history. The CDC laboratory confirmed that both individuals do have recent Zika infection.
The WHO has warned that the virus could infect 4 million people in the Americas as it launched a global response unit to fight the mosquito-borne virus. Bryce-Pease, SABC News, New York.